Happy Thursday! I'm going live with part 2 of chapter 7. I'm going to go over 4 sleep types today and how light affects our sleep, and also vitamin D and how that affects our mental health. So just jumping right in, the single most important thing to keep in mind with bright light exposure, if you remember last week I was talking about light boxes and how light is so important to our mental health and our depression and resetting our circadian rhythms. So you can find is getting that light exposure at the right time of day, and you can kind of determine when that time of day is by your sleep patterns. So the 4 sleep patterns that Dr. Ilardi talks about is number 1, the late shift. And I am so curious to know which one you are, so drop it in the comments. When I read these, late shift, do you resonate with this? You experience morning sluggishness. With difficulty waking up on time, you usually have trouble falling asleep at night as well. People with this pattern often find their bedtime drifting later and later as they stay up to the point of exhaustion, so they can fall asleep. They are sometimes able to sleep 10 or more hours and still feel tired. That's called the late shift. Number 2 is the early shift. You have little trouble falling asleep, but have a tendency to wake up too early in the morning. Often people with this pattern are awake at least 2 hours before their desired wake-up time, but they're unable to fall back asleep. Is that you? Do you wake up too early? Can't go back to sleep? Fragmented sleep is number 3. You wake up frequently throughout the night with no obvious time pattern in your awakenings. And then the last one is healthy sleep. You have little trouble falling asleep, staying asleep, or getting up in the morning. And if that's you, congratulations, you're doing something right. So the next part of the chapter, it describes when is the most effective time to use the light box, depending on your sleep pattern. And it's pretty detailed, so I'm not going to go into it. If you're curious about it, you can message me personally, and I can share with you what he says. But I'd always recommend to get the book. It's not that expensive on Amazon, The Depression Cure. So after it talks about the light and when you need light to help with those patterns of sleep, it's pretty interesting because he says even just doing the light box a few times, maybe like by day 3, day 5, you're going to start noticing your sleep improving, and by a week your sleep should be improving. And if it's not, then you just shift a little bit of how much light exposure you're getting, and you're getting better sleep. I know sleep is huge. So many people aren't getting the sleep they need. Sleep is a big factor in a lot of people's health and the way we function. There's also some frequently asked questions about light boxes because it's kind of, yes, not a very typical thing. And so is it a concern for your health? Like, what does it do? So I'm just going to go over a few of the frequently asked questions, not all of them. But one of them said, should I check with my doctor before using a light box? And absolutely. Whenever you're going to do something new or change something in your patterns that are pretty significant, check with your doctor, especially if you're already seeing a doctor for depression and you're on medication, different things like that. It's always a good idea to check with your doctor. But they are safe for the vast majority of people. It does say that there are a few things, like people with diabetes could experience eye complications. So if you're diabetic, talk with your physician about it. And also if you have known seizure disorders, talk with your physician, because light can stimulate and triggers seizures sometimes. So are there any side effects? None that have been noted in using a light box. Maybe when you're first starting you might get like a headache or a little bit of nausea, but that's because your body's getting used to that extended light. And is there a risk of getting too much light? Well, bright light stimulates serotonin activity in the brain. While that's usually a good thing, some people produce too much serotonin. So if you have, after an extended light exposure, if you start getting jittery or nervous or nauseous, then rein it in, have less light exposure, and see how that works. If you just rein it in, then you won't have that problem as much. So I'm looking at some of these other frequently asked questions just to see if any else really apply. And okay, so this one, I'm supposed to get light exposure in the morning, but I missed it today because I was running late. Is it better to try to make up for it later in the day or just wait until tomorrow? Well, when you miss your scheduled light exposure, it's usually better to make up for it later in the day, as this will allow you to get the mood elevating benefit of increased serotonin in the brain. However, if you're supposed to get your light exposure in the morning, it's important not to wait too late. If possible, try to complete your light exposure within 5 hours of your bedtime. If you can't, it's generally just wait till the next day. I think that's all the frequently asked questions I'll review. The rest aren't as significant, I don't think. And then the last thing I'm going to talk about is vitamin D and how important vitamin D is to our body. It's absolutely essential to our life. And in fact, we'd all be dead without it. Excuse me. Vitamin D actually isn't a proper vitamin, it's a hormone. And it's one of the most important ones ever discovered. A chemical key, it unlocks hundreds of genes that control the day-to-day functioning of our brain and our heart and our immune system. And it can cause different disorders in our body if we don't get enough vitamin D. So scientists have recently linked vitamin D deficiencies to a lot of diseases. And some people, even when they're outside, their bodies just don't absorb enough to get that vitamin D stimulated and going in your body. And so supplementation is a really important factor. On average, depressed patients have perilously low blood levels of vitamin D. Supplementation has been shown to lift mood among those with deficiency. In one recent clinical trial giving the SAD patients, the seasonal disorder patients, just one single multivitamin of vitamin D was found to have a large antidepressant effect. So, how does it work? How does it fight depression? Well, it affects the nutrient's role in regulating gene function in the brain, but vitamin D has a powerful anti-inflammatory effect. And as we've learned, we've talked about, and I'm sure you're aware of, inflammation is the root cause of so much illness and disease. And when we have inflammation in our body, that's not good. So supplementing is a great way to get rid of inflammation, especially if it's difficult to eat an anti-inflammatory diet. Sometimes the ease of just supplementing is so nice. So I love the vitamin D that we take. Our vitamin D that my husband, well, I take it as well. It's helping with my sleep, but that's really been effective for my husband. It has omega-3 and vitamin D in it mixed together, and it's just a teeny little gel capsule instead of those big, large omega-3 horse pills. And it has vitamin D and omega-3 and other things in it, and we take that supplement. That's been really awesome. So vitamin D deficiency is a big problem in the United States right now, and actually all over the world. And so if you aren't getting enough sunshine, aren't getting enough light, make sure you're supplementing with vitamin D. So I think that's all I'm going to cover today in this chapter. So we went over the 4 sleep types and how light affects your sleep and the importance of vitamin D supplementing. If you're curious about what my husband and I are taking, just reach out to me. I'll get you some information about that. And next week, I'm going to be covering chapter 8. It's called Getting Connected. So how does being social, being with people, affect our mental health and depression? Thanks for being on. Drop where you're coming from. I appreciate your support, and we'll see you next week.